Hi, my name is Dr. Florence Kelly. I'm a medical doctor who takes care of diabetes patients in Nairobi, Kenya. In this video, I will talk about diabetic retinopathy. I'll begin by talking about how diabetes affects blood vessels. My main focus will be diabetes affecting small blood vessels of the eye. I will briefly explain the structure of the eye and parts affected in diabetic retinopathy. I'll discuss types of diabetic retinopathy, the symptoms, the risk factors, the clinical presentation, the complications of diabetic retinopathy, and how diabetic retinopathy is treated. The images and clips in this video were taken in a hospital in Nairobi, Kenya, which takes care of patients with eye disease. Let's get started. Microvascular disease in diabetes. There are two types of blood vessels in the body: small and large blood vessels. When small blood vessels are affected, the disease is called microvascular disease. There are three types of microvascular disease in diabetes: diabetic retinopathy, diabetic neuropathy, and diabetic nephropathy. Diabetic retinopathy is a disease that affects the retina. Diabetic retinopathy occurs in type 1 and 2 diabetes, is the commonest eye disease in people with diabetes. Small blood vessels of the retina are affected. Let's now talk about the structure of the eye. How does the eye look like? The eye consists of two chambers, an inner and outer chamber. A gel-like fluid fills the two chambers to allow light to pass through to the retina for clear vision. The center of the retina is known as the macula. The macula enables one to have a sharp, clear vision. The retina changes light and images that we see into signals. These signals are sent to the brain. The brain interprets the signals, then sends another signal to the retina. The retina receives this signal as an image, and then one is able to see. For the retina to do this, it must remain healthy. What happens in diabetic retinopathy? Over time, too much sugar in your blood damages the tiny blood vessels of the retina. These blood vessels are supposed to nourish the retina. Once damaged, the supply of nutrients to the retina is cut off. The retina senses this, then sends a signal to the body to make new blood vessels in the eye. The downside to this is the new blood vessels don't develop properly and can easily leak. I'm going to talk about how a normal retina looks like. As you can see, I have two photographs of two different retina. On the left panel is a retina of a normal eye. The blood vessels are clearly visible. There are no areas of bleeding. There are no areas of deposits. On the right panel, we see an abnormal retina. The blood vessels are fewer and barely visible. There is an area of bleeding circled in black. There are two types of diabetic retinopathy: non-proliferative diabetic retinopathy, also known as early stage disease or background retinopathy. Then we have proliferative retinopathy, also called advanced stage or proliferative retinopathy. In non-proliferative retinopathy, tiny blood vessels get swollen. The swollen areas are the weakest parts of the blood vessels. They may leak fluid and cause deposits to form in the retina. These fluids can also leak into the macula, causing macular edema. Macular edema causes a loss of vision and must be treated immediately. Then we have proliferative retinopathy. Small blood vessels of the retina continue getting damaged. Some get blocked and scars form in the retina. This reduces the nourishment to the eye further. The eye senses a reduced nourishment and sends the body a signal to make new blood vessels. More new blood vessels that are abnormal are formed in an attempt to nourish the retina. These blood vessels easily bleed into the retina and the inner chamber of the eye. A buildup of new blood vessels in the eye may increase pressure in the eye and cause glaucoma. Meanwhile, scars are formed at the bleeding points of the abdominal blood vessels in the retina. These scars shrink and may peel the retina from its attachment. Retinal detachment can cause visual loss. This can be permanent. In the early stages of diabetic retinopathy, symptoms may be present or absent. Poor night vision may be the first symptom. In advanced retinopathy, one may see floaters, spots, or streaks, or cobweb-like structures, or poor color vision. Vision can get blurry or completely lost. Early treatment and diagnosis of diabetic retinopathy leads to the best outcomes. Complications can be serious, such as bleeding into the eye, more so the inner chamber of the eye, detaching of the retina, glaucoma, loss of vision due to macular edema, glaucoma, or a combination of all of them. How can I prevent diabetic retinopathy? Taking an active role in diabetes management, such as regular eye exams, good control of blood sugar and blood pressure by taking the drugs prescribed by your doctor and following all the doctor's instructions, treatment of cholesterol, healthy eating and physical exercise. This must be guided by your doctor. Early treatment of visual problems. If you have diabetes, contacting your eye doctor immediately your vision suddenly changes, such as getting blurry, spotty, or hazy. How is the diagnosis of diabetic retinopathy made? Ideally, all diabetes patients should have an eye exam by an eye doctor every year. Pregnant women with diabetes should be reviewed by an eye doctor in the first 3 months of pregnancy. How is diabetic retinopathy treated? In this case, proliferative diabetic retinopathy. Depending on the problem found in the retina, will be treated by either laser or photocoagulation therapy, eye injections, surgery of the eye. What is photocoagulation or eye laser treatments? In this procedure, the eye doctor will use a laser light to seal leaking blood vessels of the retina to save vision. Your eye will be numbed so that the procedure becomes comfortable. A light will be shone on the eye severally. Your vision will not be clear for a day or so. This may be done in more than one visit. Your night vision may be affected after the treatment is completed. How is an injection of the eye done? An injection consisting of medications that will block the signal of growing new blood vessels will be administered into your eye. The injection will be directed to the inner chamber where these abnormal blood vessels form. You may experience discomfort and tearing in the eye after the procedure. This will fade away in 24 hours. A single or several injections may need to be administered for a complete resolution of the eye disease. How is surgery of the eye done? The doctor will numb your eye. A tiny incision will be made in the front part of the eye. Cloudy or eye fluid stained by bleeding and leaky vessels will be then removed from the inner chamber of your eye. The retina will then be easily accessible, and damages in the retina will then be repaired. What are a few things to keep in mind concerning what I've talked about? Vision can diminish or be lost in diabetic retinopathy if left unattended. It's essential to have regular eye and physical examination if you have diabetes. Always contact your eye doctor when your vision changes. Treatment of diabetic retinopathy slows the progression of diabetic retinopathy but does not cure it. I hope this was informative. Like, share, subscribe, and always feel free to reach out to me in the comment section. Thank you.